In 2020, Australia's Minister for Health launched the National Strategic Action Plan for Rare Diseases. Rare Voices Australia led the collaborative development of the Action Plan, which has 3 interrelated pillars: awareness and education, care and support, and research and data. Rare disease care and support must address every facet of a person's life, not just their health. It is difficult for people to navigate their way through the different health, disability, and other systems. Timely diagnosis is critical for the best care and support, yet diagnostic delay and misdiagnosis is common in rare diseases. Timely and accurate diagnosis achieves the best possible outcomes for people. This includes the best clinical care, access to services, and peer support from others on a similar journey. There are limited treatment options for rare diseases, and even when a treatment does exist, financial support may not be available in Australia. Smaller patient numbers and less clinical evidence creates uncertainties. This makes access to medicines and other health technologies challenging. To achieve real progress, we need to strengthen collaboration between clinics, hospitals, research groups, and other organisations, and develop a network of centres of excellence that is accessible to all Australians. Key recommendations from the Action Plan include rare disease care and support that is integrated and person and family centred. There needs to be clear pathways and policy throughout health, disability, and other systems. Services must respond to people's changing needs throughout their lives. State and federal governments should develop policy more collaboratively. The voices of people living with a rare disease must be heard and shape all systems that impact them. Rare disease organisations that represent and advocate for people need greater capacity. Further funding is needed for specialist diagnostic responses, including more undiagnosed rare disease programs across Australia. Policy and funding must support equitable access to diagnostic tools and tests. Those with an undiagnosed rare disease need to be identified and given priority access to a specialised response. The Action Plan also calls for national coordination and funding of screening, including addressing urgent funding gaps within the Newborn Blood Spot Screening National Policy Framework. We need equitable and timely access to the best available health technology, including genomic services. Policy must support access to new and emerging technologies, provide fit-for-purpose, sustainable reimbursement pathways, and enable equitable access to medicines, including those that are already funded for other conditions. Through collaboration, the Action Plan can create change and drive the best possible health and well-being outcomes for people living with a rare disease. Now is the time for action.